Gentlemen, if you've noticed yourself waking up several times at night to use the bathroom, or if you're experiencing a weak urine stream, you're not alone. These may be signs of an enlarged prostate, a condition medically known as benign prostatic hyperplasia or BPH. It affects millions of men, especially as we age. But today, let's talk about a powerful, natural ally that's often overlooked: pomegranate. Yes, that one fruit could become a small but meaningful part of your prostate support strategy. Pomegranate is loaded with potent antioxidants, particularly compounds called punicalagins, which have been studied for their ability to combat inflammation and oxidative stress, both of which can affect prostate health. Some preliminary research even suggests that regular consumption of pomegranate juice or extract may help reduce markers associated with prostate issues. Now, let me be clear, no fruit, not even this one, is a magic bullet. But science supports the idea that what we eat matters. Including antioxidant-rich fruits like pomegranate in your daily diet can play a role in supporting your prostate naturally. But diet is just one part of the equation. Staying physically active, maintaining a healthy weight, managing stress, and avoiding processed foods also go a long way. Most importantly, if you're experiencing symptoms, don't rely on any food alone. Consult your healthcare provider, get your PSA levels checked, and make sure you're addressing the root cause appropriately. So, can one fruit support a healthier prostate? Absolutely. But the real power lies in combining smart nutrition with proactive self-care. Stay informed, stay healthy, and remember, small daily habits can lead to powerful long-term results. Benign prostatic hyperplasia, commonly referred to as BPH or prostate enlargement, is a non-cancerous growth of the prostate gland that typically occurs in men as they age. The prostate is a small, walnut-shaped gland located just below the bladder and in front of the rectum. Its primary role is to produce seminal fluid, which nourishes and transports sperm during ejaculation. As men get older, particularly beyond the age of 40 or 50, hormonal changes in the body can cause the prostate to gradually increase in size. While this growth is generally not dangerous, it can lead to uncomfortable urinary symptoms. One of the most common issues caused by an enlarged prostate is pressure on the urethra, the tube that carries urine from the bladder out of the body. This pressure can cause a range of urinary problems, such as a frequent urge to urinate, especially at night, difficulty starting urination, a weak or interrupted stream, and a feeling that the bladder isn't fully emptied even after urinating. These symptoms can affect a man's quality of life, disrupting sleep, causing discomfort, and even leading to anxiety or frustration over time. It's important to understand that BPH is not the same as prostate cancer. However, the symptoms can sometimes overlap, which is why regular check-ups and communication with a healthcare provider are crucial. Many men assume urinary problems are just a part of getting older, but they should never be ignored. There are safe, effective treatment options available, ranging from lifestyle changes and medications to minimally invasive procedures. Catching the condition early can prevent complications like urinary tract infections, bladder stones, or damage to the bladder and kidneys. From a health and wellness perspective, it's also worth noting that lifestyle choices, including what you eat, can influence prostate health. While BPH is common, especially in men over 60, it is not inevitable. Staying informed, making healthy choices, and working with a medical professional can go a long way toward managing or even reducing the severity of symptoms associated with an enlarged prostate. Diet plays a significant role in maintaining prostate health, especially as men age and become more susceptible to conditions like benign prostatic hyperplasia, BPH, or inflammation of the prostate. While no single food or nutrient can prevent or cure prostate issues, numerous studies suggest that long-term dietary habits can influence the health and function of the prostate gland. A balanced diet rich in certain vitamins, minerals, and plant-based compounds may help reduce inflammation, support hormone balance, and promote overall prostate wellness. Many health experts recommend a diet that emphasizes whole foods, particularly fruits, vegetables, legumes, and healthy fats. These foods are packed with antioxidants, natural substances that help protect the body's cells from oxidative stress, a factor linked to chronic inflammation and cellular damage. For example, tomatoes are rich in lycopene, a powerful antioxidant that has been studied for its potential in supporting prostate health. Similarly, vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds known as glucosinolates, which may help support detoxification pathways and reduce inflammation in the body. High intake of red or processed meats, excessive dairy, and saturated fats, on the other hand, has been associated in some research with increased risk of prostate discomfort or dysfunction. While these findings are not absolute, they suggest that reducing these foods in favor of plant-based options may offer benefits. Fish rich in omega-3 fatty acids, such as salmon and sardines, also provide anti-inflammatory support and can be a healthy alternative to processed meats. Hydration also plays a role. Staying well hydrated helps with urinary flow and function, though it's best to avoid excessive caffeine and alcohol, especially later in the day, as these can irritate the bladder and worsen urinary symptoms. Importantly, dietary choices work best when combined with other healthy lifestyle habits. Regular physical activity, maintaining a healthy weight, managing stress, and not smoking all contribute to better prostate outcomes. While diet is not a standalone solution for prostate conditions like BPH, it is a powerful tool that can support the body's natural systems and improve quality of life. Choosing the right foods consistently over time can make a noticeable difference. It's about building long-term habits, not chasing short-term fixes. For men concerned about prostate health, incorporating more nutrient-rich, anti-inflammatory foods into their daily meals is a simple, non-invasive way to support their body and possibly ease symptoms. Always consult a healthcare provider before making significant dietary changes, especially when managing any medical condition. Among the many natural foods that support prostate health, certain fruits stand out for their impressive nutrient content and potential to aid in reducing inflammation and oxidative stress. One of the most researched and promising fruits in this regard is the pomegranate. Known for its deep red color and rich, tart juice, pomegranate is not only delicious, but also packed with beneficial plant compounds that may support prostate health when included as part of a balanced diet. Pomegranate is rich in antioxidants, particularly a class of polyphenols called punicalagins, which are found in both the juice and peel. These antioxidants are powerful in fighting oxidative damage, which is a key factor in the progression of many age-related health conditions, including issues related to the prostate. Chronic inflammation and oxidative stress can contribute to the enlargement of the prostate over time, so consuming foods that help counteract these effects may be beneficial. In some studies, pomegranate juice or extract has been linked to improved prostate markers. For example, preliminary clinical research has explored how pomegranate may help slow the rise of prostate-specific antigen, PSA levels in men with prostate concerns. While these findings are not definitive and more research is needed to confirm these effects, they point to the fruit's potential role as a supportive dietary addition, not a cure or treatment. It's important to clarify that consuming pomegranate or any single fruit should not replace medical evaluation or therapy. In addition to its antioxidant properties, pomegranate also contains vitamin C, potassium, and dietary fiber. These nutrients contribute to overall health and can help support immune function, cardiovascular wellness, and digestion, all important factors in aging men. The fruit is also hydrating and naturally low in fat and sodium, making it an easy and smart choice for most diets. What makes pomegranate particularly interesting for prostate support is its synergy with other healthy lifestyle choices. When paired with regular physical activity, reduced intake of processed foods, and good hydration, this fruit can be part of a proactive approach to managing the effects of aging on the prostate. Even if consumed a few times a week, whether in juice form, seeds or rills, or as part of a smoothie, pomegranate can contribute valuable nutrients that support cellular health. As always, it's essential to consume even healthy foods in moderation. Excessive fruit juice intake, for instance, can increase sugar consumption, which may not be ideal for individuals managing blood sugar levels. Reading labels and choosing unsweetened, pure pomegranate juice, or opting for the whole fruit can help you maximize benefits while minimizing drawbacks. In summary, while no single fruit offers a miracle solution, Pomegranate has earned attention for good reason. With its rich blend of antioxidants and nutrients, it stands as a powerful example of how nature can provide valuable tools for supporting prostate and overall health. Always pair such dietary choices with guidance from a healthcare provider to ensure they complement your specific health needs. When discussing natural approaches to supporting prostate health, it's important to refer to scientific evidence responsibly without overpromising or making claims that go beyond what current research supports. Many fruits, herbs, and plant-based compounds have shown potential in early studies to benefit prostate function, but that does not mean they are cures or replacements for medical treatment. One such example is the pomegranate, which has been the subject of multiple clinical and laboratory studies exploring its effects on prostate health. Research into pomegranate's potential benefits has focused primarily on its antioxidant content. Compounds like punicalagins and ellagic acid, which are found in the juice, peel, and seeds of the fruit, have demonstrated strong anti-inflammatory and antioxidant effects in laboratory settings. Oxidative stress and chronic inflammation are known contributors to the progression of prostate enlargement and other age-related conditions, which is why reducing these internal stressors can be helpful. Some studies have indicated that pomegranate extract may slow the rise in prostate-specific antigen, PSA levels, a marker often monitored in men with prostate concerns. However, while promising, these results are preliminary and should be interpreted with caution. It is essential to understand that many of these studies are either small in scale or conducted under controlled conditions that don't always reflect everyday life. For example, the doses of pomegranate extract used in clinical trials may be more concentrated than what someone would typically consume through diet alone. Additionally, results can vary widely between individuals based on genetics, lifestyle factors, and existing health conditions. This is why scientists and health professionals are careful not to present such findings as conclusive or universally applicable. In scientific research, it often takes years of repeat studies and large-scale clinical trials to confirm that a natural substance has a consistent and measurable effect. So while pomegranate and similar fruits are recognized for their high nutrient content and health supporting potential, they should be viewed as part of a larger strategy, not as standalone treatments. Transparency matters when sharing health information. While it's exciting to see natural foods being studied for their role in promoting wellness, overstating their effects can mislead people into skipping necessary medical advice or delaying important treatment. Anyone experiencing symptoms of an enlarged prostate, such as difficulty urinating, frequent nighttime trips to the bathroom, or weak urine flow, should consult a healthcare provider for a proper diagnosis and evidence-based treatment options. Incorporating fruits like pomegranate into your routine may offer supportive benefits, especially as part of a diet rich in whole, plant-based foods. But these should always complement, not replace, professional medical care. Keeping expectations grounded in science ensures that people can make informed choices that truly support their long-term health. Supporting prostate health goes far beyond any single food or supplement. The most effective approach is a combination of healthy lifestyle habits that work together in harmony: diet, regular exercise, and routine health monitoring. This synergistic approach not only promotes better prostate function, but also contributes to overall well-being and longevity. Starting with diet, what you eat on a daily basis plays a powerful role in maintaining hormonal balance, reducing inflammation, and supporting optimal organ function. Diets rich in vegetables, fruits, whole grains, legumes, and healthy fats, especially those found in nuts, seeds, and oily fish, can provide the body with key nutrients and antioxidants that protect against cellular damage. At the same time, reducing consumption of highly processed foods, sugary snacks, excess dairy, and red or processed meats can help limit pro-inflammatory triggers that may contribute to prostate enlargement and other chronic conditions. Exercise is another crucial component of prostate health. Regular physical activity helps regulate body weight, improve circulation, and support hormonal function. Men who are overweight or obese are more likely to experience prostate-related issues, including increased urinary symptoms. Engaging in consistent movement, whether through walking, cycling, strength training, or swimming, can help reduce this risk. In fact, studies have shown that even moderate exercise a few times a week can lead to a significant improvement in symptoms associated with benign prostatic hyperplasia, BPH. Physical activity also supports better mental health and stress management, both of which are often overlooked in discussions about prostate care. Monitoring your health is equally important. As men age, regular checkups with a healthcare provider become more critical, especially when it comes to the prostate. Monitoring prostate-specific antigen PSA levels, getting digital rectal exams when recommended, and discussing any urinary changes with your doctor are all part of a responsible, proactive health routine. Early detection of any changes can lead to better outcomes and reduce the risk of complications. Sleep and stress management also play a role in this synergy. Poor sleep and chronic stress can lead to hormonal imbalances and inflammation, which may exacerbate prostate problems. Establishing good sleep hygiene, practicing relaxation techniques, and maintaining strong social connections are simple but effective ways to support both prostate and overall health. When these elements, healthy eating, regular movement, proper medical care, adequate sleep, and stress control, are combined, they create a powerful lifestyle framework. Each part reinforces the others, creating a balanced and sustainable approach to well-being. While no single element can guarantee prevention or reversal of prostate issues, together they can significantly reduce risk and improve quality of life. Ultimately, the goal isn't perfection, but consistency. Small daily choices, practiced over time, can make a big difference. This integrated approach empowers men to take charge of their health and support their bodies naturally and effectively, without relying on quick fixes or unproven methods. Understanding when to seek medical advice for prostate health is just as important as adopting good habits. While certain dietary choices and lifestyle improvements can offer meaningful support, they should never be seen as a replacement for proper medical evaluation. Especially if you begin experiencing symptoms. Many men tend to dismiss early warning signs of prostate issues, believing them to be a normal part of aging. However, overlooking symptoms or delaying a check-up can lead to unnecessary complications that are often preventable with timely intervention. Common symptoms of an enlarged prostate or benign prostatic hyperplasia (BPH) include a frequent urge to urinate, especially at night known as nocturia, difficulty starting urination, a weak or interrupted stream, and a feeling of incomplete emptying of the bladder. Some men may also experience a sudden, urgent need to urinate or may struggle with dribbling at the end of urination. While these symptoms can range from mild to severe, even mild changes should be discussed with a healthcare provider to determine whether further testing or monitoring is needed. It's also important to recognize that not all urinary issues are caused by BPH. Other conditions, including urinary tract infections, bladder dysfunction, or even prostate cancer, can present with similar symptoms. This is why a professional medical assessment is essential. A doctor may perform a physical examination, conduct a blood test to check prostate-specific antigen PSA levels, and recommend imaging or other diagnostic tests based on your individual case. These evaluations help determine the exact cause of the symptoms and guide appropriate treatment. Men with a family history of prostate problems, especially prostate cancer, should be especially proactive about screenings. Even if you're not experiencing symptoms, having a conversation with your healthcare provider about when to begin regular screenings can be an important step toward early detection and prevention. In many cases, prostate conditions are much easier to manage when caught early, before they progress or cause complications. Seeking medical advice is not just for those with current symptoms. It's also a smart choice if you're considering making significant changes to your diet or starting supplements aimed at supporting prostate health. A qualified healthcare provider can help you understand potential interactions, ensure that any changes are safe, and guide you toward evidence-based options. In conclusion, supporting prostate health is about taking a balanced, informed, and proactive approach. While certain fruits like pomegranate may offer valuable nutrients and antioxidant benefits that support prostate function, It's important to understand that no single food or remedy can replace medical care or serve as a cure. The key lies in combining smart dietary choices with regular physical activity, stress management, and ongoing communication with a healthcare provider. Benign prostatic hyperplasia is a common condition that many men experience as they age, but it doesn't have to disrupt your life. With the right knowledge and habits, you can take meaningful steps toward improving your well-being and managing symptoms naturally and safely. Always pay attention to changes in your body, seek medical advice when needed, and use scientifically supported methods to guide your decisions. Your health is an investment, not an experiment. By integrating nutrition, movement, regular check-ups, and awareness into your daily life, you're not only supporting your prostate, you're building a foundation for long-term vitality and quality of life. Stay informed, stay proactive, and always prioritize your health with both confidence and care.